Like the various discounts that come with one's graduation into senior citizen territory, Medicare becomes available for those 65 and older, a health care plan that is more affordable than most traditional plans, but navigating uncharted territory can be confusing. Here to help break it down is Angela Edwards with the Trident Area Agency on Aging. Thank you for being with us, Angela.
Thank you for having me.
Okay, so I say that it's for the groups of 65 and older. There are a few little caveats to that. Maybe you can tell us what some of the exceptions are.
Yes, typically it's for individuals that are 65 or older, but it also covers individuals who have been deemed disabled through Social Security, and they also become eligible for Medicare prior to turning 65.
Okay, so some people with disabilities can qualify before they turn 65. Also, it's necessary that for how many years do you have to be working in a job that contributes to Medicare?
Generally, Part A is generally free, Part B has a premium, but as long as the person or their spouse, if it's a child who's now on Medicare, if they're claiming it off of their parents, you've paid your 40 quarters. Typically, I believe that's about 10 years, but as long as you've paid into the system, you can get Medicare. Part A is going to be free. Part B is going to have a premium for almost everyone. There are programs that can help to pay for the Part B if their income and resources meets the guidelines for those programs.
So it's very much like Social Security. You pay into the system, and then when you're of age, you can
get something out of it.
You can get something out of it. So hopefully for people of my generation, there will be a Medicare and there will be Social Security, but that's a whole other segment.
Whole other show.
Right. So you were mentioning Plan A, Plan B. Let's go through some of those plans. So can you tell us what each one is and how that would apply?
Right. So Medicare Part A is the hospital coverage. Like I said before, most people get that part free. Medicare Part B is the medical coverage. It does have a monthly premium that individuals pay. Most people pay, or they qualify for assistance with paying for that. And then there is the drug plan that covers your medications. That has a monthly premium and deductibles. And then there is the Part C, which is where someone can bundle all of their Medicare benefits, the Part A, the Part B, and their drug coverage into one particular company to provide their Medicare benefits to them.
And it doesn't even end there, because there are also Medigap plans.
Yes.
Can you tell us what a Medigap plan is?
So what a Medigap plan is, and some people call it supplemental, but there is still the same thing, is designed to supplement Medicare's Part A and Part B. So once Medicare has paid on a claim, whether it's a hospital or medical, there's either going to be a deductible or some copay, co-insurances that Medicare isn't going to pay. That generally will become the responsibility of the individual. But if they have purchased that Medigap or supplemental policy, then they will step in and pay their portion. Depending on the policy that the individual has chosen, it could be they will pay all of that balance or they will pay a percentage of that. It just depends on which policy the individual chooses.
I see. It's very much an alphabet soup, and
yes.
There are professionals out there who can help walk you through it and find the best plan that applies to your personal needs. Well, this is a good place to take a break, because when we come back, I want to talk about some important dates that are coming up. We often hear that this is the time when you need to apply. This is when you need to renew. And if you miss that window, you're going to have to wait. So let's talk about that after the commercial. We'll be right back. Welcome back. We've been chatting with Angela Edwards. She's with the Trident Area Agency on Aging. We've been talking about Medicare, and this is definitely a subject, Angela, that we agree can talk about for hours, because it can get quite intricate and nuanced. And so with all the different plans, you hear the commercials on TV, Plan A, Plan B, Plan C, and then all the Medigap plans, Plan F, and so forth. These all apply to different individuals to accommodate their needs. But there is one thing that everybody needs to stick to, and those are the dates. So maybe we can go over some of the upcoming dates that people need to mark on their calendar and keep at the back of their mind.
Okay. Yes. Those dates are the annual open enrollment, which is getting ready to start next month, and that will run from October 15th through December 7th. That is for individuals who are already on Medicare and want to make some changes. They may want to change their drug plan. They may want to change their Medicare Advantage plan. So this is the time for them to do it. They can look at their medications and make sure their medications, along with the other benefits, that is all going to be cost effective for them, with the plan of your choice starting January 1. Then January 1 through March 31st, if you're in a Medicare Advantage plan, you can make a change to go back to original Medicare with a drug plan.
And then for people who are happy with the coverage that they've got, they don't have to do anything.
They don't have to do anything, but we always advise them at a minimum to do a drug comparison. And you don't want to come January 1st to realize that some of the medications you were taking are not going to be covered in the new year.
What kind of savings are we talking about using Medicare versus a traditional private insurance plan?
If you don't have any coverage, that's where the big savings comes in at.
Mark your calendars, everybody. And if you still need some help, which it is very confusing to navigate for the very first time, you can always go to Angela, Trident Area Agency on Aging. I want to thank you so much for joining us.
Thank you.
We're back after this.